everyone, my name's Amanda Neil. I'm a researcher at the Menzies Institute for Medical Research at the University of Tasmania in Hobart, Tasmania. The work that I do is a combination of health economics, health services research and population mental health research. I do lots of work in terms of across the health sector, and I actively engage with other researchers across the university and within the Tasmanian Health Service and beyond. I'm also the health economics lead for the Alive National Centre for Mental Health Research Translation. I have a very eclectic background, I can say, in terms of my career development. I started off in science, I've ended up in health economics. My primary school education was in Cairns in far north Queensland. I then went to the Australian National University, worked in the Commonwealth Government for a couple of years, and then moved to the University of Newcastle to do my PhD. I was working in University of Newcastle, and that's where I actually started my work in mental health research. When I was there, I also had my child, who ended up me leaving academia for a number of years. We then moved to Hobart. You can call us one of the initial climate refugees. And so I've been in Hobart since 2013 and was very fortunate to obtain a position at the Menzies Institute for Medical Research as a health economist and population health researcher. An area of research that I'm currently involved with is the relationship between language literacy skills and mental health. So this is an area of research that has been acknowledged internationally as needing research, that there is a relationship between language literacy and mental health outcomes, but there has been limited research to date. Low levels of literacy are a real issue in Tasmania. Tasmania has the highest acknowledged level of low functioning literacy in Australia. The estimate is about 1 in 2 people have low functioning literacy within the Tasmanian population. Tasmania also has the highest levels of lifetime mental health disorders within the Australian population. Australian adult population. The relationship between low literacy skills and mental health has been acknowledged, but it's not widely acknowledged. And this is the area of research that I and the team that I work with are looking to raise awareness of and improve practice and policy around this approach to support people with low literacy skills. I have a lot of passion for this particular piece of research, and that stems from my own experience of being the parent of a child who had delayed language development and in turn delayed reading and writing development. And so I've seen the impact of that process for my child, and therefore have much empathy for everyone with low literacy skills and how they need to engage with society and the challenges that they face in our society, which is very much reliant on our knowledge skills in terms of our ability to engage. Outside of the work environment, I like being outside in nature, particularly looking at the birds around me and taking photographs of them. More birds than other animals, but it's a combination of being outside in nature, because that I can personally feel how my well-being improves being outside in nature, and then also in terms of taking photographs of birds. My photography has improved over the years, I can certainly say, and I'm really pleased when I actually manage to take a good shot.